coach Tess from HealthEversity, and today we are going to be focusing on modifiers. This series is going to be focusing on CPT modifiers for the CPC exam. So let's jump right into it. And today we are going to be focusing on modifier 53. So let's jump right in with modifier 53. Okay, modifier discontinued procedure. So this is our first keywords here. Keyword procedure stopped before completion. No need to complete the procedure. So this is modifier 53, discontinued procedure. All right, let's jump in right into the key points here. Use modifier 53 when the procedure is discontinued. Okay, discontinued. Okay, that's my highlighter right here. And after anesthesia is administered to the patient. Okay, next point. Modifier 53 is valid only when attached to a surgical code or a medical diagnosis when the procedure was started but had to be discontinued. So they started it and then they discontinued it because of extenuating circumstances. So they started it, then they had to stop. Okay? Do not use modifier 53 when a laparoscopic or endoscopic procedure is converted to an open procedure. Okay, the medical record must support modifier 53 with descriptive documentation. Descriptive, they're telling you why. Okay? Descriptive documentation as to why the procedure was discontinued and how much of the procedure was continued. So see the big term here, why, right? And why was it discontinued, as well as how much of the procedure was completed. Okay, so that's the reason for using modifier 53. Okay, we have some more here. Okay, we have some more. All right, let's go to the next page here. Some more key points. Modifier 53, we have 2 more points. Many insurance carriers will only cover the primary procedure with the modifier 53 if other procedures were planned. So you have to tell them exactly what happened. Documentation support for modifier 53 reduced services should include as much, right here, information as possible to support the fullest extent of services performed. So you have to be very detailed, okay? All right, let's jump right into the quiz or an example. Okay, so I have the answer down here. Okay, Dr. Rezin brought Daniel into the ER or OR, for an endoscopic resection of a renal tumor. Daniel was put under general anesthesia and the procedure was started. As Dr. Rezin moved the scope into place through the established neuroostomy and touched the tumor to prep for removal. Oh my God. Daniel's blood pressure dropped from 150/80 to 100/50. Dr. Rezin stopped the procedure immediately, and Daniel was sent to recovery. The surgery was rescheduled when Daniel's blood pressure was stable. So let's look at it a little deeper right here. So this is what they went in for, the endoscopic resection of a renal tumor, right? So he started the procedure with the scope, going through the prep for the removal of the tumor. Then her blood pressure stopped. Her blood pressure started to drop. He had to stop then, right? So he stopped the procedure, and then eventually he had to reschedule. Okay, so we're using 505.62 with modifier 53. I hope you enjoyed this one, and stay tuned for other videos in this modifier series. Talk to you soon. And welcome back to our series of modifiers, and today we are going to focus on CPT modifier 54. And there goes the pen again, and you need to have your pen, your highlighters or your markers out, or your pencils out to make notes. So this is a good practice, okay? That's why man have all these color notes, is just because it's just been a habit all these years of studying. Okay, so modifier 54, surgical care only. That's what the provider is doing. Surgical care only. He's not doing anything else but just surgery procedure. Only performed the surgical procedure. He's not doing pre-op, post-op. He's not doing anything else. He's just only focusing on surgery. No post-op management. Okay? So he's only performing surgical procedures. So let's go to my next page. Okay, surgery only. All right? Modifier 54, appended only to the surgical procedure codes. Global procedure modifiers 54 should be reinforced with wording such as preoperative, surgery only, and postoperative care, documented in the patient record. So it has to state that this is what this doctor did. That's all he did. He's not here to do pre-op or post-op and all that good stuff. No, he's just there to do surgery only. Documentation should support date ranges reported on claims for split billing services. So you have to write a date where he did. Global procedure modifiers 54 should be reinforced with the wording, right? Oh, it's the same thing up here. Oh no. Okay. All right, we're moving on to the next thing. And let's move on to our quiz. All right. So let's look at this. It's for surgery only, and this is our answer down here. Okay. Dr. Patel performed a repair. That's what he did. A repair of a ruptured spleen with a partial splenectomy. A different provider performed the pre and post-operative care. So now you see, that's all he did. He did a repair, surgery only. And then another doctor came in and did pre and post-operative. And we're going to use 38155 modifier 54. And this has come to the end of modifier 54 as we continue in our series of CPT modifiers for the CPC exam. Talk to you soon.